You're listening to Evergreen Media Network. I am Cindy Schwartz, and this is the Patient Partner Show. My co-host Jeannie Roller has got the day off, and we are talking today a subject that I found kind of funny when I first heard it, and then I realized when I did some research on it, it's really not ha-ha funny. Is video game expertise beneficial to surgery patients? Yes, it is. So many times we've said, at least I haven't often in my life with people's children or whatever, I'm like, why aren't they outside playing, games? Why are they inside video and gaming and all this kind of stuff? And the same thing I had heard one time when I went in for a surgery, and the nurse had said to me, oh, you got a really good surgeon. He's very adept at playing video games. And I was like, I've never heard that before in my life, that the two would go together. Well, yes, they do. Especially since a lot of the surgeries now, laparoscopic surgery, robotic systems, and those kind of things, VR simulators, are computer prevalent and also video prevalent. So I just want to read a couple of facts. I did a little bit of information on it. And I think that that's a good thing. Maybe when you go in for your surgery to say, hey, is this surgeon, really prevalent, and is he really expert in doing some video games, and ask what different types. I mean, a little bit more information to make yourself feel more comfortable with the surgery that you're looking at. So one of the things that it does say for the data is surgeons who game regularly for more than 3 hours per week make almost 40% fewer errors, complete procedures almost 30% faster, and score nearly 42% higher in laparoscopic skills tests, opposed to non-gaming doctors. The biggest things, of course, you can figure it out, are a hand and eye coordination. It develops the ability to translate what you see on a 2D screen into 3D physical movements. The visuospatial awareness, so strong depth perception and reasoning, spatial reasoning, help doctors navigate delicate, minimally invasive spaces. So that would lend itself to some of these robotic surgeries where they're making tiny cuts. I know that I've seen some lung cancer surgeries where they literally do it in your armpit, one side of your body, just that one armpit, and they're putting all different kinds of cameras and their arms and stuff that they need for the surgery. And they can put it down in the same incision, which is amazing, just absolutely amazing. Faster reaction time, certainly that would make sense. And the other thing is it gives them the depth perception to see what it's actually like to work inside a body cavity. To me, that would be, you'd have to learn the left from right to left. I know in cameras and stuff like that, if you're recording in a studio, you look at the opposite direction on how to move the cameras and whatever. It's not what you'd think it would be. It's the opposite. So I would think the same thing would be true for the video gaming. The interface familiarity is another thing that's a big deal. So operating the gamepad, it does train your brain to be in sync with what it actually needs for you to do, as opposed to just walking up and not really being familiar with what gaming is. The information that I found is looking at first-person, high-precision puzzle platformers and fine motor motion games are the ones that show the hyper-precise joystick adjustments that you do in robotic surgery and you do in the video games to be the most highly effective. The other thing some of the articles go on to say is it develops microspatial adjustment and delicate hand-eye coordination. So not just high hand-eye coordination, but really delicate procedures, because think of what you're actually trying to target as the surgeon when you get inside the body with veins, nerves, muscles are bigger, but those kind of things. I mean, I didn't go to medical school, so I don't know all of the names of that, but I can just imagine all this stuff crammed together in your body and how to separate that and how to separate it well. It also, the games help people to recognize that if you're not as adept at doing those kind of video games, the overcorrection that you do and sloppy movements The games will penalize you so you know where your parameters are in situations like that. I remember a game, it was literally called Operation when I was a kid, and when you hit the side on the person's body in the on the game board, it would give you like a jolt or whatever, so you knew that you had to be really, really precise to take like the leg bone out or the arm bone, and I don't know if that was a pre-surgery kind of a game back in the day, if you will, but it did do it with that. So I can see where a video game would also give you that kind of parameter where if you get too close to this, you get too close to that, that's going to get you off course, literally and figuratively. Fast reaction times. That's a big thing, too, going forward if it's a good thing, and then also going forward if it's a bad thing, if you've got to make that adjustment that quick. I would think that the video gaming, you get yourself backed into a corner, however it is that the game plays out, it's a split-second decision to change which way you're going. And forcing a player to track, in some of the games, multiple moving targets over a wide visual field trains the brain to monitor an entire surgical cavity. So that's what I was talking about before, that when you get inside the body cavity, look at all the things that are in there. To me, it wouldn't be like, and I'm not a surgeon, so I've never done the inside of a body cavity surgery, if you will. But to me, you'd think as a layperson, maybe it's as big as what outer space is, that you're not going to knock into things. But then again, it isn't that big. You do have just a certain amount of room to work with. So you'd have to be really cautious to keep in the guidelines of what you're trying to do. It also refines the reflex control needed to handle unexpected complications. And that's what I'm talking about going forward in a positive way. Yeah, you keep going forward. This is exactly what you anticipated. But if you've worked a lot of these games and you've erred out or X'd out or whatever the term is, then you can say, all right, this is what I should have done. And this is what I could have done. This is what I maybe could have done. And you have all those options to try to figure out in the surgery what could be beneficial to the patient, to you, and also to you as the surgeon, as the doctor, to go with plan B, plan D, whatever plan Q that you have to go to. You have some backup plans when not everything goes exactly the way you thought it was going to go, because how can you know exactly everything in each specific person's body cavity in the region that you're working with? Yeah, generally it would be the same thing, but not specifically. I can see that happening. It brings up, this one article brings up the name of a program called Silent Scope, and various military tactical video games are most beneficial that require subtle, controlled finger movements. Those games punish minor physical mistakes and require the player to translate a 2D screen layout into multi-axis spatial movements. So there are a lot of benefits to it. I kind of thought when I first heard it that, what are they really talking about? And yeah, I knew that robotic surgery, and that's been around for a while now, at least in my knowledge, that it would come with benefits from using video games. I wouldn't have known 3 hours a week. I wouldn't have known how much time would be the most benefit, but it does make sense. Another one that they bring into one of the articles is they say Star Wars Race's Revenge is one of the big, shout out to who's producing that. And also Wii Sports. I know I've done Wii Sports myself, and it's amazing some of the stuff that it does teach you and it keeps you in the zone or whatever. But building visual acuity and depth perception is the biggest thing that the articles are saying about working on video games as training for better surgery techniques. So on that note, ask your surgeon if he's a video gamer. Stay listening to Evergreen Media Network.